Good evening, Pawan, Ayush, Swati. Thank you so much for joining in. We'll just do something. We'll just join in, rather, we'll just start maybe in a couple of minutes. Let the others also join in through the links, and then we can start the session for today. Thank you. All right. While everyone's just getting ready to join in, I understand it's a Saturday evening and it's a very difficult time for a lot of people to take time out and attend a session, and definitely one on healthcare for that matter. So let's hope that while we go through this session today, we also have a lot of understanding for this particular industry. So my name is Anju. I head the admissions and marketing at Rishihood University. So Rishihood is India's first and only impact university, and we identified about 4 or 5 areas of impact that we realized that these are the areas that we truly needed to work on in case if we had to go ahead and build our nation, which is at the core of everything we do at Rishihood as well. So we have courses in areas of entrepreneurship, healthcare, creativity, public leadership, and likewise. So today's session was more focused on healthcare, and this also comes with the advent of the NEET exam. A lot of you all have been giving the NEET exam. I keep getting calls from some of the students that I've met in the recent past across schools that, I've given the NEET, my parents wanted to give me the NEET, I've done it, but I don't think I've cleared through, and now I don't know what to do. Whether I go into a program which can offer me, let's say, a bachelor's or rather, an MBBS degree, should I go into BDS? What are these are the standalone or these are the straight jacket career options that we always know of. These are the careers that we already know of. There are millions and millions of people in our country who pursue a medical degree, predominantly because from, I think, 2 to 3 to 4 decades now, all we've heard from our peers, from our seniors, from our parents, from our families has been that there are only 2 careers that are fantastic, which is either you become a doctor or you become an engineer. But I genuinely feel that the healthcare industry specifically has so much more to offer. It has offerings within areas about administrators, for areas where public health professionals can come into picture, areas which include diagnostics. So I think today it's not that we don't have doctors, we do have a lot of doctors, but we also need the systems that can strengthen this part. And one aspect that when we look at countries growing, when we look at developed nations across the world today, a very strong part of their development is a very strong healthcare system and a very strong education system. So the entire idea with the session today was to try and give you a context with respect to the healthcare industry, also try and see that what is there in this industry, which is today more than a 322 billion dollar industry in the country alone. What is there for offer? Not everyone's becoming a doctor, not everyone's becoming a dentist. So what are the sort of careers that you can look at if you do not choose to go the regular medicine way? So the other question that was in my mind when one of the students asked me that, can you do a session? You keep doing so many counseling sessions on various areas. Can you help us also explore new age careers in healthcare? And I was constantly thinking as to, whom to invite, who would be the person who could come in and give us some sort of knowledge in this area. And I couldn't be more happy than having Dr. Anil Kaul today join me for this session. Dr. Kaul, thank you so much for joining in. Just a brief
Thank you, Anju.
on Sir's profile as well. Dr. Kaul is the Dean for School of Healthcare at Rishihood University. He's a physician dentist with more than 20 years of experience in as a faculty in research in public health care, in healthcare management, and his special focus has been on prevention and diagnosis of emerging and re-emerging infectious diseases. You heard me right. Dr. Kaul is also someone who's very closely worked on the COVID-19 problem and has helped out with a lot of solutions for the same as well. He's also been modeling around a lot of places where we can improve patient health, we can reduce the healthcare costs in our country, and also the reason why at Rishihood we do not offer mainstream healthcare programs, but programs that will truly have an impact in terms of where the country goes ahead. Interestingly, Dr. Kaul also served with the US State Department as an embedded senior public health advisor during the Iraq War. He brings a very global perspective to the crisis, as well as how we go about dealing with pandemics like COVID and otherwise. So I think you would get a very good sense of how to understand this field and what sort of careers. Now, we didn't want this to be a monologue the way it is going on right now for the last 4.5 minutes that I've been talking. But then we wanted this to be a more interactive run. So all of you all on the session today, you can chat with us on the chat box. You can put in case if there are any views that you'd like to share, or likewise, you can put it on the chat box. You could also put in your questions on the Q&A. What I'm going to do is I'm going to present a set of questions that I've already received from some of the students in the past to Dr. Kaul, and then we can see, where the discussion goes ahead. Dr. Kaul, again, thank you so much for joining in, and a very, very warm welcome to you. One of the questions that I've been seeing incessantly being bombarded by students and even their parents is that NEET abhi nahi hua. NEET is not clear. My child has not cleared NEET, and I just met a parent about 2 hours back on the same question, that she's prepared so much across the years, but she's not clear the NEET. I don't know where my daughter is going to go, and there is an interest in medicine. So what is the first advice that you'd like to give these parents?
First of all, thank you, Anju, for that warm introduction and opportunity to speak to the students. I think we have to keep in mind that all those students who, at least majority of the students who appear for the NEET, they have passion for service.
Yes.
They want to serve the humanity. They want to do something good for the society. So keeping that in mind, I think one thing which we fail to understand is that we can serve in different capacities. Specifically for healthcare. Healthcare sector is filled with a lot of inefficiencies, as most of us or most of the participants would have seen. There is erratic quality, there is no unequal access. There are a lot of issues in healthcare system itself. So I think we can contribute in a very meaningful way towards developing a very strong, healthy society. So NEET is not the only pathway. Let me give you an example about my own sort of journey. I wanted to become a maxillofacial surgeon. I did my medicine from Chennai, then went to dentistry, then did my public health. I found during that period that when I was practicing medicine, it was not giving me the satisfaction that I was curing a disease. But what I was trying to figure out is, why does a patient become a patient? So that I think triggered that curiosity in me, and sort of pursued that path. But I think there are a lot of opportunities, particularly during the last, I would say probably 5 years. Within India, opportunities have grown phenomenally. But
Okay.
COVID has fast forward everything. COVID has sort of disrupted the whole thing. And we have seen during COVID, most of us have seen that it was not only the doctors or the nurses who provided care, it
Mm.
was the lab technicians, it was the X-ray, it was the home delivery person who would come and get your test at home, or hospital technicians. They were also critical in taking care of our patients. So I think we have realized that these are not the only the professions, like doctors are not the only ones. But I think on the other side, I have also seen that a lot of younger generation people, they have other skill sets. They have skill sets like, I can talk about my own children, like they want to play video games. But how do we use those video games skills in healthcare? Some of our best robotic surgeons have been phenomenal video game players during their younger days. So the future is there. So we have now artificial intelligence, machine learning, all those things combined can give us many more answers in the healthcare field. So there are a lot of opportunities. Public health, it gives us basically a tool where we can protect a community from getting a disease. So there are those opportunities. Then there is the biggest, my favorite is innovation. If I am interested in engineering stuff and I'm writing my NEET and my heart is not actually in medicine, but in the middle, I'm still a little confused. There is no harm in pursuing your engineering, whether it is chemical engineering, mechanical, or whatever it is. You can pursue that, but you can focus on health. At Rishihood, I think that's the best part, where you have the liberty of you can take
Mm.
computer science and health.
I
You
agree.
can you can do those multidisciplinary approaches, and that's where the innovations will come. That's where newer technologies will come. If you get siloed into just a clinical medicine,
Mm.
you get blindsided. You don't have any idea what's going on the research side. You don't know what's happening in the industry. At engineering side, you don't know what's happening in the computer sciences. So those are the problems if you get siloed into a specific branch.
So, interestingly, we've spoken about so many other career options as well, but I find increasingly that students are not. How do they get there? See, the entire retooling that we've had across schools, even today, to a large extent, is the fact that if you're interested in medicine, you are, pushed towards a career in medicine. You're pushed towards a career to become a doctor, to become a dentist, to become a physiotherapist. I think someone had also put in the question box that, what about BPT? What about physiotherapy? So there are two ways to look at it. One is a confusion as to what sort of careers can I look at if I don't become a mainstream doctor? And second is the careers. How do I evaluate the worth of these careers? Because I believe there are a lot of cases where a student is able to get into a medical career, but that not might be the right space for him to grow. So how does he match growth and innovation, and what should a student ideally do after someone who's passed out of grade 12? What are the areas in which he can sort of steer himself or herself to get that clarity?
I think one thing is to have the passion for whatever you want to do. I think unless you have passion, you will get frustrated. I think that's the bottom line. Any student, I tell them that if they have passion for something, they will enjoy a career in that. If they are forced into a career because of whether it is peer pressure or parental pressure, whatever it is, you will not enjoy it. You will not be able to contribute. Yes, you might make good money, but you will not relish it. You will not enjoy that career path. And you will not be able to innovate, or you will not be able to contribute to the science of medicine if your heart and soul is not in it. So you have to keep that mind. So if you are interested in a particular field, there is see one thing which has changed in India in last, I would say, 20, 25 years is that there are diverse group of professions available. Yes, you said it rightly. It used to be engineering and medicine. That's about it. If you don't get into MBBS, you go into BDS. You don't get into BDS, you go to pharmacy or whatever other options are there. But I have seen, this is my personal experience, is that we have almost a overproduction of dentists in this country right now. I would say, if not hundreds, but at least tens of students who apply every semester to my former program in US. They want to do public health, they want to do research, they want to do, and it's a waste of resource. They became dentists just because there was peer pressure or something was there, but they don't want to practice dentistry. We also have I'm in India right now, and in India, particularly North India, we can hire a dentist, a fresh dentist, for around 20,000 rupees, which is pathetic, which is really unfortunate.
And the costs of acquiring a dental degree are so huge in India as well.
Yeah. When I graduated from dental school in Lucknow, there was one dental school in entire UP. It was entire UP, Uttarakhand combined. Today, in Lucknow itself, there are 7 dental colleges.
Okay.
So those are the issues. So we have to be very conscious about what career paths are there available. So just because you have peer pressure that you didn't get into MBBS or you just BDS is available, don't do it. Don't do it because you will get frustrated. So I think ask questions. This is what I ask everybody. Never hesitate to ask. If you don't know the answer, there are I tell all my students, there can never be a stupid question. There can be a stupid answer, but ask questions. So because it's going to be your lifelong career. So ask somebody from the field, ask somebody, what do you do? How do you do it? Maybe you can innovate, maybe you can contribute. So asking questions is always good.
Okay. So that also sort of brings me to another phase in which, and I think this is a career path that I myself have been trying to understand a lot. And there is some research, some literature out on the websites or on Google about it. But I feel that there is a lot of talk now, specifically after the COVID-19 episode, on public health systems, on healthcare, systems, on hospital administrators. But there a lot of students still don't have clarity. If I come into, let's say, Rishihood for a 3-year or a 4-year program in public health, what after that? Where do I go? What do I look like as a professional? So if you could also give us some idea on who is the public health professional, first of all, and what is the sort of career pathways that students can take through?
Yeah, I think it's a very valid question. I think if I was entering the field, I would want to know what my job opportunities are, what are jobs available. I think one thing which COVID has fast-tracked is the creation of a public health task force or a public health cadre in India. Late last year, I think Government of India issued that white paper that they will create this public health task force. And there are no professionals available. There are professionals, there are some schools offering MPH, Masters in Public Health, but none of the schools is offering an undergraduate degree. And now the question is, what jobs are available there? Let's backtrack a little bit. Healthcare in India is a state subject. Every state does its own healthcare. So many states have already started creating public health jobs. One example, just yesterday, that Odisha is one of the first states to create a public health card. So they will need people to fill up those jobs. And as we have seen in the West, the healthcare costs are spiraling out of control. And I think in a country like India, we have to focus more on prevention. Yes, we have the technology, we have the best surgeons, we have the best healthcare facilities, but not everybody can afford that. But I think we have to focus on prevention. And who are the people who can do that? It's a public health professional. It's not a physician, because physician is not trained to tell you, wash your hands. or eat a healthy food. So those kinds of things, or go for a walk, because those are not the traits of a clinician. That's why we call them clinicians. So public health professionals, whether it is uh, hygiene in a restaurant, those are kind of things which public health professionals do. There are public health professionals who uh, work in schools, for example, whether the food is healthy, or in universities where the dorms or all those facilities. There are so many jobs, air quality, nutrition, all these things public health professionals do. I think there are multiple national and international agencies which hire public health professionals. They cannot, they will not hire a physician for those positions. WHO, for example, they have public health jobs. I mean, international. ICMR, the Indian Council of Medical Research, they hire public health. Public Health Foundation of India, which is one of the premier public health institutions in India. The World Health Organization, all these national or international agencies, they hire public health professionals. In addition to that, the industry, manufacturing industry particularly, they hire public health professionals for occupational safety and all that, because those also come into that public health arena. So if you have an undergraduate in public health, you will easily get into those kinds of jobs. So those are huge opportunities. And state health departments, as I said, the states, they have started creating these jobs in alignment with the national public health charter creation.
So the question out here then again is also, we understood that of course public health is something that we definitely need and we have to focus on that. But again, a lot of questions that I get is it necessary for my child to specialize in this area at an undergrad level? You know, we do have so many institutions going ahead and offering a master's in public health, because the idea is that you understand that game much better. You are at a much more mature stage in your life, both biologically and otherwise as well. And therefore that is required. But at an undergrad level, is it, how beneficial it is if someone goes ahead and specializes? And it's not just for public health, like say, even for example, something like cardiology. If someone wants to deep dive and specialize, is it necessary that they should get into a specific undergrad program within cardiology, or should they just become a regular MBBS and then look at specializations and likewise?
So, Anju, there's a fundamental difference between medical school admissions in India compared to the West. In the US, particularly, you have to do 4 years of undergraduate before you apply to the medical school. So you have a broad-based experience. You take humanities, you take anthropology, you take whatever, engineering, whatever you want to take. But then you go to get into, so you are much more mature when you get into the medical school. But in India, it is a much earlier. It's straight out of high school. So yes, the maturity may not be there. But I think for public health, what has happened, the awareness, I think when we started these programs, let's say 20 or 30 years back, we didn't have Google and internet and all that stuff. These days, I think students are much more mature. They're much more aware. So I would say at least my experience is at least 20% of the students, incoming undergraduates, they are aware of public health. And COVID has helped that. Whether it is using a sanitizer or whether using oximeters or all that stuff. So they have started. And I think talking to my own extended family members who are in college or just getting into college, there is much more awareness about how public health systems work or not work. So it's always heartening to learn from them or hear from them how they think, because they look at things from a different perspective. So in a meaningful way, they can contribute.
So the other part is, of course, yes. So I agree with you that I personally also find this generation to be much more learned. I believe someone has a little bit of an issue with the language. Josefa, I'll try and see if we can mix and match with both English and Hindi. So we do have a generation which is very learned right now, and obviously they do have access to the right resources as well. And like you said, if they can specialize right now within public health, I think it makes more sense for them also. The other aspect that I've been looking at, and very interestingly, a commerce student actually came to me yesterday. And his question was कि मैम मुझे ना ये नहीं करना, like मुझे MBBS की तैयारी नहीं करनी, मुझे नीट मैंने नहीं दिया है, मैंने obviously I'm a commerce student, लेकिन मुझे hospitals में काम करना है. So how do I go ahead with that combination?
See, Anju, it's very, very important to understand that finance, accounting, commerce, it's needed in all professions. If you don't understand the basics, what happened during COVID, most of, I would say almost all the physicians did not know about commerce. They did not know about supply chain. Nobody had any clue. Everything was taken for granted. But then what happened, net result was they were not able to take care of the patients. So commerce, to be honest with you, in US, we admit students from different backgrounds, even lawyers. We need policy, we need health policy, we need lawyers for that. We need chemical engineers to help us devise new methods. I have worked personally with material scientists to develop some nanotechnology products. So I think commerce or accounting or finance, they can fit into any profession.
So you would say that if someone has to get into a hospital sort of a segment, either they do a management program or they can do a healthcare management program as well. Get to understand that basics.
Yeah. See, hospital administration, healthcare administration, there's a lot of overlap.
Okay.
Hospital administration, you are trained to take care of a hospital, which is a closed entity. Healthcare management or healthcare administration gives you much broader sort of training, I would say, put it this way. So you have much more, you are provided much more skills. You can take care of a hospital also, but you also, like hospital, let me tell you something. Hospital, we focus on infection control. We focus on accreditations, like we have to get inspections and all that stuff. So we focus on those things. We also focus on finance, but in healthcare administration also we have to focus on finance. As I said, money is important, no matter how you look at it. So we do that, but hospital administration, hospital management, it is more specific for a brick and mortar type of a thing. Like, you know, you have to understand the whole you have to take a holistic approach of managing a hospital. The job-wise, I think there are many jobs opening up in healthcare administration because we need health administrators, whether it's a small dental clinic. Again, if you have a healthcare administrator background, you can work in a dental clinic. But if you have a hospital administration background, it might be a little tricky. But there are so many clinics, so many private hospitals opening up. So jobs are amazingly increasing rapidly.
Okay. And a couple of other things as well. I think we have a student here. So she's not cleared NEET. And I think this is the classic, question that a lot of students have been coming up with to me as well. Passion is to do nursing, but NEET clear nahi hua hai. So then what? You know, what are the areas that they can go in for? Because I think they've identified their passion as well. We're talking about careers like public health, like hospital administration. I had a conversation with someone the other day about being a telesurgeon or a health analyst. You know, we can be in healthcare and become an analyst as well. But for someone who's looking at mainstream, like nursing, like cardiology, like physiotherapy, what do they do in case if they're not going through the mainstreams? Because I believe private institution costs are really, really high.
Yes.
And specifically for mainstream programs like these.
Yeah, I think, I don't know the regulations in India, you have to have NEET for you to get into a mainstream medical education programs.
For most of the government institutions, yes, state institutions. Private, I think they do have their aptitude tests and likewise also.
So there are these options of getting into a private institution. Is that right?
Yeah.
Okay.
But then is pursuing nursing or is pursuing. We've been trying to look at very mainstream career options, whether it is, core medicine or specialized options like cardiology, nursing, physiotherapy, or any of these. Is it even worth it pursuing all of this? I think the question is there because students get into a program 3, 4, 5 years, and I'm seeing millions and millions of students in the market, but they barely earn. They have, they don't have living structures that can actually support them, and that percentage of people who are really doing well in this area is very, very minuscule.
Well,
So
yeah.
how does someone look at other avenues as well?
Yeah, I think one thing with particularly with nursing, we have to be careful that there are 3-year nursing programs and 4-year nursing programs. Internationally, 4-year nursing programs are much more acceptable. You can pursue, and those are the kinds of things one has to be very clear about. And that's where I keep on repeating this: ask somebody who's already in the field. And nursing, I think, nursing is if you have passion for patient care. I have seen nurses who make financially, if you just talk about financially, they can make much more than a physician. So we have so many options in nursing profession. You can become a nursing professional administrator. You can become a nursing faculty in academics. So there are a lot of those options, and unfortunately, there is a lot of shortage of nursing and medical school faculty. There are not many faculty members available. So there are a lot of career options. Even if one does not want to pursue clinical nursing, the teaching nursing side, there are a lot of opportunities there also.
Okay. I think that sounds a lot of other questions as well. And to all the students who are there on the call as well today, there are so many other careers that you can look at. There are patient assistants, there are bioprinting experts, there are VR therapists, virtual reality therapists that you can look at. Like I mentioned, health data analytics. You can combine data sciences as well as knowledge of healthcare to become an analyst in that particular field as well. You have people with the focus on public health that Dr. Kaul had mentioned. You have people who are doing lifestyle strategy. How do you live your lifestyle so that you can avoid getting into any of that situation before you, sort of have to go and pay those really huge hospital bills as well. Now, another interesting take, and this was a question by a counselor that had come to me some time back, was that I think COVID has showcased to us, of course, the paucity of a very strong healthcare system in India. But at the same time, we saw these instances in different states where the governments actually went ahead and sent across the small, a little bit of mix of powder, which was with our own Ayurvedic, concoction. And it was told to all of their state members that you're supposed to consume this every day so that you can avoid COVID. So what is the relevance, if I may say, in our Indian practices like Ayurveda, like Siddha, that we can utilize? And does that also have a career option that these students can look at?
I'm glad you asked this question because I was recently in Chennai, because that's I call it second home. And some of my medical school colleagues, we were just having a casual conversation about COVID. And they said that during the COVID, they were distributing these officially, the government was distributing these Siddha herbs or small pouches to people. And they said it made a dramatic sort of difference. So that is where I feel that we have not, let me repeat this, we have not explored indigenous medical treatments. Whether it is Ayurveda, whether it is homeopathy, whether it is Unani or Siddha, we have not. We have anecdotal instances where our grandparents or great-grandparents used to use, let's say, turmeric or ginger or whatever it is, for minor ailments. Today, let me digress a little bit. Today, majority of our clinic visits by patients is on 3 diseases. It's diabetes, it's hypertension, it's arthritis. And the modern medicine has not provided how to prevent these diseases. Yes, we have symptomatic, we have painkillers, we have insulin, we have whatever medicines we have just to symptomatic relief. We have not succeeded in preventing these diseases. And there is a huge opportunity where there might be something in our traditional medicine which can not only treat but also prevent these diseases. During COVID, I used to work in COVID lab for almost 2 years. Touch wood, I never got COVID, but I was using something very traditional Indian Ayurvedic stuff just for inhalation purposes. I'm not saying that that's what helped me, but there's a need to validate that. There is a need to investigate that. There might be something in it. That's where we have to sort of go with open mind. I think there are huge opportunities. And again, comes back to the same question. Never hesitate to ask questions. If you feel that something is working or not working, ask. Okay.
That's great advice as well. And I think that is one field that is still very unexplored within the industry. Do we have any hospitals today that are, because I think a lot of, again, I'm coming back to and circling back to the same question from a parent perspective, that, where does my child go and work? Where does my child go and study? So yes, we understand that there is a need for public health. We understand that we need more, or rather, we need more able administrators to run hospitals, to run healthcare centers. But do we have existing jobs, and do we have hospitals that are maybe hiring people in specifically for these sort of roles, or do we have people who are practicing, medicine through Ayurveda, through Siddha, and they are being officially or rather onboarded into mainstream hospitals? Because I think the career part, no parent is against the child's passion. It is only that I believe the parent just does not want the child to be poor. So, you want to have those career options that can go ahead there.
I think we have this new approach in Indian health system, which is still being sort of discussed at a policy level, where there is going to be an integrated approach for healthcare delivery, I mean. So in addition to allopathic, Ayurvedic, Unani, homeopathy, and Siddha medicine options will be available at a healthcare facility. So it's like if you follow something what's going on in China, they have followed that integrated medicine policy. So if a patient comes in and we call him, the person is called navigator. They decide, okay, this person can be cured by traditional Chinese medicine or the Western allopathic medicine. So they decide that, but it is available under the same roof. So same thing I think is being pursued here, where we have these trained Ayurvedic physicians who can be housed in the same hospitals, and they can provide the same care to some of the patients. So I think those things are being explored, and I think it's just a matter of time before, because I think the realization has come that allopathic medicine is not answer for everything. Just taking a pill does not solve all the problems. So I think there are different approaches that needed. In the West, in addition to allopathic, we have osteopathic medicine. Okay. I don't know whether how many of you have heard about it. It's an osteopathic medicine. They just are like physicians, but they believe in holistic approach. Like they treat the whole body as it is. And there's a lot of component of massage and physical manipulation. So those are the kinds of things which are pretty mainstream in US at least.
Okay. So we have a question here from, I think, Nidhi, who wants to know that, is there any idea if you can give her about a bachelor's in perfusion technology?
See, I think it's a very good question, because I think she has done some research. Because India is, I think recently there have been a number of articles in the mainstream media about India is almost an epidemic of non-communicable diseases. And one of the main ones is diabetes. And diabetes, the main cause of concern is chronic kidney disease. I think dialysis centers are opening up right and left in India. And in dialysis, we use perfusion. We have so many dialysis centers, dialysis technicians, perfusion technicians needed. There's going to be a sort of a huge demand for these professions. I'm not sure if any institutions are offering perfusion technology, but there must be. There must be. I know for sure institutions like Manipal and already Institute of Medical Sciences, they do have some programs on that because they have to cater to the public sector. And Apollo hospitals, they also have their own in-house training programs. But I'm not aware of if there's a formal university level programs on that.
And is there a difference that a child pursues a bachelor's, which is like a BSc? Like at Rishihood, we have a BSc honors in public health and hospital administration. Does it matter that they do this and not a professional degree like an MBBS or anything of that sort? Does it matter today at least?
It does not, because I think what at least, again, I will give you the, if a particular medical school wants to take a candidate outside NEET, I don't know if that is possible. I'm just, again, ignorant about it. They will see if somebody has a public health undergraduate, that person will definitely get much higher acceptance than somebody who has not. Again, it is always, if somebody has, same thing with research, if somebody has published a paper, it will definitely get them in, and they will be much more competitive than somebody else. So I think if you want to stand out in admission to a medical school or any other career path, yes, these things definitely matter.
Okay, so just as an extension to that as well, if you are inducting about students to the School of Healthcare with us as well, what would be the ideal research, or is there something that you haven't asked for? I would like a student who has done this sort of a research or this sort of work before coming into the program, so that it's easier for them to understand, because I think that can draw a parallel for them for a lot of other other programs as well.
Anju, I think I did lost the first part of your question.
So I just wanted to understand that, is there a certain bit of research or is there a certain profile that you will want your student to come in with? That you need to do these research papers, or how does a medical or a student wanting to get into healthcare build his profile?
See, I'll give my own experience. I sit on admissions committee for a couple of medical schools. The only thing I'm looking at, first thing I ask, why are you getting into medicine? Okay, I don't want to hear that. Like, I have had examples where I have had answers like, my dad wants me to do medicine. Okay, that's a no-brainer. Okay, we close the door. You have to have a passion for it. Number two, show me something you have done to show that passion. If you have done public health, what have you done to prevent a disease, or at a school level, at a home level, whatever it can be at any level. Show me something. Even if it is a small poster, or a small cartoon, or a small video, whatever it is, show me something. One more thing which I want to sort of emphasize today is the World Health Organization has declared that social determinants of health. Health is important. As physicians, as clinicians, we worry about health. But there are also important elements which are called social determinants, like housing, like food, like mental health, like family structure, like transportation, like climate. All those things impact health directly or indirectly. So we need professionals who have passion for health, who have interest in health. There's a difference between health and medicine. Okay, so they can help in those areas, like social, we call them social determinants of health, and this is universally accepted fact. I think India is also signatory to that. So they're also working on towards that. So transportation, how many people die in India because of road traffic accidents? A lot of them. One of the major successes of public health in the US was use of seatbelts. Nobody thinks of seatbelts as a public health, but it is a public health issue.
So does a public health professional also have to think of these?
Well, yeah, of course. Of
So when
course.
they're working on policies, so which also, interestingly brings me to a perspective that as someone who is probably pursuing a public health major in their program, uh, will it be beneficial for them if they take an economics minor or a
Absolutely.
minor from, let's say, technology or a minor from, let's say, business?
Absolutely. I think you're talking about which are important
Yes.
mainstream topics, but I have seen some like anthropology and public health. I never thought of anthropology will have a role in medicine or healthcare. But yes, I know of a project being done how the social media is impacting health, or how the television is making people unhappy because they see something on television, they want it, and then they internalize it and then become unhappy, and it causes public health issues. Suicides. It's again a public health crisis. So these are all public health related issues, which no doctor can treat it. MBBS people cannot do anything about it.
That I agree. And I think it just puts the entire industry into perspective, because we are not talking about, we're not talking about a cure. Most of us are worried about we become a doctor, we'll cure the entire world and we become godmen there. But I think the entire idea is that you prevent it from happening. And for a country like India, I think that's much more important given our numbers and given the way that we are expanding as well.
Yeah, I think one thing which has happened in the last few years is that the government has, maybe it's the COVID which sort of fast tracked everything. The government has now realized that not the tertiary care, the state of the art medical tourism is going to solve problems of common Indian. It's going to be public health. You can treat. I have been quoted many times of saying that we have the best trauma surgeons on the sidewalks taking care of people falling off the roof, but nobody goes up on the roof and puts up a fence. And that's what we should do. We should prevent people from going over the top. Just because we have the, and again, I've said this many times, is also just because we have the technology, we don't have to use it. Just because we have a insulin pump doesn't mean we have to use the insulin pump. Just because we have the incubators doesn't mean that we have to be sort of careless about premature births. So those are the kinds of things which are, it's a much broader policy issue. But I'm just saying that there are so many ways these young kids can sort of help.
Absolutely. And I think that's the scenario, that's the opportunities that we're looking within this industry as well. And there are so many, I think, players that have come in. You have Apollo, you have Columbia Asia, you have Manipal Hospitals, you have Max Healthcare. I think so many organizations that have now started to also deep dive into this aspect and not just look at, clocking in people to come in and take their services, but also from a prevention perspective. So the other question I wanted to know is, let's say I'm a grade 12 student. I am someone who's just finished grade 12 right now, and I've given the NEET, I've not cleared it. Maybe I want to take a break. Are there internships? Are there opportunities that students can look for within organizations that they can learn more about these newer areas of careers in healthcare?
Yeah, I think there are opportunities everywhere. It's just a question of asking and looking around. I think the opportunities, like in New Delhi NCR area itself, there are at least 6 or 7 major public health organizations which have, if not hundreds, but at least 50, 60 people working. So there are these organizations. It's just a question of asking.
Right. And I think you just need to ask the right question, or rather just ask a question. Forget
Yeah.
the right
No,
question is
no.
about to
There's,
just ask the
as I
question.
said, there's no right question.
Fabulous, sir. Thank you so much for this. And in case if any of us in the audience have a question, please do feel free to put it in the Q&A box. Again, like we said, there is no right or wrong question. There just needs to be a question. And I will be able to bring it to Dr. Kaul as well. Meanwhile, there are a lot of interesting things that we're doing at Rishihood, specifically within the School of Healthcare as well, right from medical camps to a lot of other activities that students go through. But like Dr. Kaul mentioned, the idea is to focus on a larger issue. COVID has been a very difficult time for most of us. People have lost lives, people have lost families. And if you can prevent that, let's look at a broader system part as well. We need this education, not just at a college level. I think we need this education at a more systemic level where it starts right from our schools, right when we are younger, that it is necessary. And a lot of it is in our value systems already. So I'm hoping that you all will pursue that path and not necessarily, stick yourselves onto the pathway that millions and millions of others are doing because everyone's going, let me also do it. Just don't go ahead and finish up that. I have a question here from Puneet. Puneet, again, thank you so much for joining in the session. Puneet is a brilliant counselor, does work with a lot of students, and he wanted to, his question is, in your experience, does after healthcare, post-graduation, is it better to stay in India or go outside India for employment? And you've had an experience of both, so I'm pretty sure you're absolutely primed to answer this.
Well, again, the question is, what do you want to do? You want to serve, then you can serve anywhere you want to serve. There are challenges everywhere. Whether it is India or overseas, challenges are everywhere. So I think for training purposes, and right now for post-graduation, it might be better to sort of get an exposure of international healthcare systems. So that is worthwhile. But again, using the experience from India, because again, a lot of Western students come to India to gain first-hand experience because the number of patients we see here is phenomenally more than what they see in the US or any other Western country. So to gain that practical knowledge, India is the best place. But yes, the technology and which is again, it's leveling off. I'll be honest, I think it's leveling off. But to just get a flavor of how things work or not work in the Western society, I think that might be a good way of just experiencing that. So that I think we can learn from it what direction to take and what not to do.
Okay, I have a question here from Neha, who wants to know what exactly do you teach in a public healthcare program?
Okay, public health has three fundamental things. One is we teach about, because without numbers, you can't do anything because you cannot prove anything or disprove anything. So we teach about biostatistics, for example. We teach about epidemiology. We do that. Those are the two things which we definitely teach. But then we also teach about basic human elements of human body. Because as a health profession, you need to know what arteries are, what veins are. Obviously, you have studied that during your +2, but we go a little more deep into anatomy, physiology, and infection control, microbiology, virology. We go into that areas because that is where I think it's important. We also get into finance and economics because without finance and economics, it's very difficult for anybody to survive. So I think those are the things. In addition, the best part is you have electives. You can take electives from any of the other schools. You can take from education, school of education. You can take psychology. You can take computer sciences. You have that flexibility, so you can mix and match. You can do a major in public health, but you can do a minor in computer sciences if you have that passion, or you can do public health and you can do a minor in health administration. You can mix and match. So that flexibility you have. Again, it's up to you what drives you, what sort of triggers that curiosity in you, and where you think you can gain most. I think these combinations. See, I give my own example. I did medicine first, then I did dentistry. People thought I was crazy. Okay, that's fine. But NIH, this is honest. NIH, National Institutes of Health in US, was doing a study on effect of oral health on pregnancy outcomes. Okay, they could not find anybody in entire US who was a dentist and who had trained in OBGYN. Okay, I was put in charge of that panel, which had people who had 40 years of experience. Okay, you never know where your skill sets can be used. Yes, if I was a mainstream, simple MBBS, MD, whatever, nobody would have bothered because there are dime a dozen on that. I was picked to help Secretary Hillary Clinton in Iraq because I had dental and medical background and women's health background. So they wanted somebody who can help redevelop Iraqi healthcare system. So you never know where these skills, but I had passion for it. Okay, let me put it this way. So again, if you have passion for it, go for it. So Rishihood gives you that flexibility. If you want to do public health and economics, you can. If you're good with numbers, please do it. You'll be an asset to any organization you join.
I agree, and thank you for that. And I think the other question that a parent has written to me is, uh, they understand the relevance of the program. They understand, why their child should go ahead. But then you always, the perspective, at least in India, is that 90% of the people who are pursuing anything in medicine or healthcare is also because it's a social status. It's a social symbol, right? So is a program in any of these eclectic, if I may use the word, courses like public health or hospital administration, or you're looking at therapy, virtual reality therapists, and so on and so forth. Do these courses have the same sort of an equivalence as any other mainstream program?
Things are changing. I think there is more acceptance now than it was, let's say, 5 years back. There is that awareness now that these are also equally important programs. But yes, there is this social thing, which unfortunately it's more prevalent in some parts of the country than in other parts of the country, that our son or daughter has to become a doctor. And which is unfortunate actually, because now we have, as I mentioned about dentistry, like you have dentists in every field now, because they just went to dental school because they could not get into MBBS, they got into BDS, and now they are not able to open their private practices. They don't have a job. I have even heard that they got their BDS, but they never saw a patient. That's a whole different issue. So those are those social issues. Yes, those are very true, and but they are changing.
Okay. And I have a very pointed question from Swapnil, which is absolutely away from the discussion, which says, which would you choose between nursing, cardiology, and neurology, if you had to choose the best career amongst these three?
You said cardiology?
Cardiology, so BSc, bachelor's in nursing, or a bachelor's in cardiology, or a bachelor's in neurology.
Okay, the question I can flip it around. What do you have passion for more? Because all three, in my opinion, all three are equal, because that's where you serve the humanity, or that's where you do what you do. But what do you know about cardiology or neurology or nursing? Nursing, you can cover both, cardiology as well as neurology, but you have to have passion for it. It's as simple as that. If cardiology, if something you have experienced, your grandparents, your family member, somebody, if that is what is driving you, go for it. If it is neurology, if it is something to do with the brain, yes. But I'm not in a position to recommend one over the other, because again, even for research projects, students come to me and ask me, give us a research project. I never gave them a research project. I said, what do you want to research? Because I want them to take the ownership. Because once they take the ownership, they feel proud that it was their choice. It was not pushed by parents or neighbor or somebody, uncle or aunt. It was their choice that they chose neurology or cardiology or nursing. Then they will feel proud about it. So I would hesitate to answer that question.
All right. So Swapnil, you're on your own. Go and find out what you're passionate about. And I think then you can go ahead and figure it out. Thank you so much again, everyone out here. I think we're at the end of our questions as well. Thank you so much, Dr. Kaul, for your time.
Thanks a lot. Thank you.
So many interesting parts that we've covered. To all of the attendees on the call today, I think Rishihood is, like I mentioned, we have a very focused, vision in terms of impact. There are areas that we are very clear that these are the places where our students can go ahead and create impact as well, as and when they move. And healthcare definitely is on our top, is on the top of our minds as well. So if you think that you are interested in a career in healthcare, which will be different, which will have true meaning, and you would like to go ahead and explore a very interdisciplinary program, a program that can give you the wings to explore areas in economics, in artificial intelligence, in management, in commerce, and combine them with the knowledge that you have in healthcare to become craft a career that you will own yourself. I think you should get in touch with us. I will request my colleague to probably drop in my contact numbers. We also do a lot of closed group counseling sessions where we can learn a little bit more about your profiles and then guide you onto which sort of areas that you can look at. So do take advantage of all of those. And the admissions to the 23 intake are obviously open for all of our students. In case if you wish to apply for that, you will have our team get in touch with you for the same as well. Thank you so much for sparing time on a Saturday evening. I wish you all a very, very healthy weekend, and of course a weekend filled with a lot of happiness and success. Thank you so much. Thank you so much, Dr. Kaul. Lovely interacting with you today.
Thank you.
Thank you so much.